Outcomes and predisposing factors of two prophylactic treatments in dense invaginatus premolars. This retrospective study was published in JOE 2022 by a Thai group. The idea of this article is to discuss two different prophylactic techniques that are used to manage teeth with dense invaginatus. The first technique is called prep and fill, where you will drill the extension of the dense invaginatus and then you will restore the cavity. However, if there was an exposure, then you will do a direct pulp capping. The other technique is the reinforcement technique, where you will apply a sealant over the extension to protect it. So why do they use these two prophylactic techniques? They believe these teeth are prone to continuous contact with the opposing teeth, and this will lead to wear of the extension and then eventually will lead to pulp exposure. And managing these teeth endodontically will be complex, according to them. For outcome assessment, they use clinically there should be no sign and symptoms, and the teeth should respond normally to cold test. For radiographic assessment, there should be no radiographic lesion. PDL space should be there, and lamina dura should also be intact. For the results, they evaluated 216 teeth premolars with dense invaginatus, 190 teeth treated with the prep and fill techniques, and only 26 teeth treated with the reinforcement technique. And this is because of the matter of preference for the technician in Thailand. This, however, would give us also a non-accurate comparison between the success rate between these two different techniques. Overall success rate for prep and fill was 95, and for reinforcement technique was almost 81%. However, and despite the high success rate they have presented in this article, I would disagree with their approaches in managing premolars with dense invaginatus prophylactically as they do. For me, if a tooth is presented to the clinic with a normal pulp, even if it has a dense invaginatus, I would keep an eye on them and follow them up regularly and closely. And if I was worried about the occlusal forces that might end up exposing the part of the pulp that is inside the extension, I would just go and shave the opposing tooth rather than going as extensive as they went and preparing the extension, and I might end up as they did in some cases by exposing the pulp. So I believe their management is a little bit invasive, and I would prefer to monitor the teeth, and I would not interfere until there is a sign that requires me to interfere.